My name is Dr. Alozie Ndubuka. I'm a medical practitioner at St. Ives Specialist Hospital. I am a general practitioner and a member of the West African Postgraduate College of Surgeons. The importance of my area of specialty in St. Ives, general practice and surgery, is that we take care of cases that come into the hospital that may require surgical interventions and surgical advice. We prep them, we supervise the procedure, and we deliver quality surgical care to such patients. Well, St. Ives has been quite an interesting place to practice medicine within the Nigerian context. We do give quality care to our patients, and we work as a team in this hospital. And the joy of the staff of St. Ives manifests in the performance of their duties and in the service to their patients. We are unique in the sense that we value our patients. We carry our patients along in every procedure we do. We make the patient understand that he or she has the right to quality care. He or she has the right to know what is being done on him or her and why the doctor or doctors have chosen to treat him or her in the way so chosen. Nigeria is quite a unique place to work in. One of the major challenges we as doctors face in Nigeria, St. Ives Hospital not being an exception, is the problem of religion. Religious practices in Nigeria make the work of the doctor more difficult than it should be. Why? Because patients tend to believe more in prayers. They forget the important religious aspect that says prayer without work is dead. When a patient falls sick, he or she first starts by going to his church or to his mosque and end up reporting to the hospital when the problem has advanced and when care may not be as optimal as it would have been if presentation had been earlier. That is one challenge. Then the second challenge, which medical practitioners in Nigeria have, is the challenge of self-medication. Many people tend to take drugs by themselves first before coming to the hospital. They have friends and family who are not medical practitioners prescribing drugs for themselves. And sometimes these drugs end up causing more harm than the problem that they are trying to treat. So upon presentation, the doctor first have to treat the ailment and the problem caused by the drugs. That's the second challenge we have. Then the third challenge of practice in Nigeria is the economy. The economy. Many doctors are restricted in the scope of care because of affordability of drugs and other procedures by the patient. The government has a role to play in this. Nigeria is a signatory to the African Union 2001 Declaration on Health, which suggests to African countries to budget at least 15% of their annual budget to healthcare. If this is done, probably healthcare will improve much more in Nigeria than it is now. At St. Ives, despite these challenges, we have devised systems to rise above them. Systems to assist our patients who might be financially challenged, systems to also educate our patients on the dangers of self-medications and also on the dangers of relying alone on prayers without working. The peculiarities of healthcare in Nigeria can be summed up by saying that healthcare in Nigeria is affected by the unique nature of the Nigerian environment. In Nigeria, the stress level within the society is so high, probably because of the economy and other allied problems, and that brings about a very unique challenge of hypertension, which is rising more and more within the Nigerian environment, and also belief systems, which impacts on the freedom of the doctor to treat his or her patient as he or she feels the patient deserves. The first tip I will give, which is unique in every part of medicine, is that the earlier you present to the hospital for treatment, the better for your care. Early presentation leads to better care. That's one. The second tip I will give to those watching this is always discuss your problems with your doctor. And that includes medical advices given to you by non-medical people. Take, for example, a friend tells you to take a particular drug, and you know quite well that that friend is not a doctor. No matter how convincing the friend's argument is, the best thing for you to do is that you should discuss it with your doctor, and the doctor will be able to educate you on the rightness or otherwise of such an advice. Then the third tip I will give to my patients is to be aware of hygiene. What I call hygiene awareness. Most of the illnesses we pick up in Nigeria are infective illnesses. And infection comes when your personal hygiene is relegated to the background. You have to make sure that you wash your hands and you take care of your general body hygiene. A very interesting thing which many people do not know out there is cholesterol. People know that high cholesterol could be a problem. But people do not know that low cholesterol on its own could present a problem itself. And one very unique problem of low cholesterol, which many people do not know, even some medical practitioners do not know, is that low cholesterol has been linked to violent attitudes. A study done some years back was able to relate the level of cholesterol to the level of violence in the society. It was seen that people who are more prone to violent tendencies tend to have cholesterol levels that are quite low. So with this, it now behoves on everybody to find out what level is their cholesterol. Is it within normal, or is it low or high? Now, a funny incident that once happened here in St. Ives Hospital has to do with religious beliefs. There was a particular patient we had who was being prepped for surgery. When the surgical team was ready and invited the patient to come into the theater, the patient insisted that she had to have her bath with a particular soap before going in. And she refused to move despite the seriousness of her condition until that soap was brought by her mother to have that bath. Yes, today we can laugh over that. But at that particular time, we were all stressed up because if the outcome had been bad, if the patient had lost her life, the press wouldn't have heard about this. Probably the hospital would have been blamed by even the relatives of the patient who were aware of this unusual demand. So, in rounding up, I encourage us all to listen to our doctors. For those of us who are quite religious-minded, pray that God gives your doctor the wisdom to treat you properly and adequately. Thank you very much.